One world, Offering our reverential pranams to Sadguru Sri Madhusudan Sai, respected elders, brothers and sisters, everyone seated here and those watching us live from around the world, a very good evening and welcome to the Valedictory session of the Global Healthcare Conference 2023 here at Sathya Grama. We have all embarked on a journey over the last 2 days through the various sessions, a journey of exploration, of knowledge sharing and collaboration in the pursuit of advancing global healthcare. In this valedictory session, let us celebrate the strides we have made collectively and acknowledge the dedicated efforts of all the participants, the researchers, the practitioners, the policymakers, and industry leaders. Your passionate talks and commitment for building better societies have certainly fueled the momentum of progress, pushing the boundaries of what is possible in the realm of healthcare. We would first like to extend a very hearty welcome to our dignitaries on stage. Firstly, to our chief guest, Shri Dinesh Gundurauji, Honorable Minister for Health and Family Welfare, Government of Karnataka. Dr. Sunil Gavaskar, legendary cricketer and trustee, Sri Sathya Sai Sanjeevani Hospitals. Dr. C. Srinivas, trustee, Sri Sathya Sai Sanjeevani Hospitals. Shri B.N. Narsamurthy, Chancellor, Sri Sathya Sai University for Human Excellence. Our dear founder, Sadguru, Sri Madhusudan Sai, the guiding light who is spearheading service projects in nutrition, healthcare and education across 33 countries and the visionary behind this global healthcare conference. We will commence with Vedic Invocation by the girl students of our university, and they will chant the Sannyasa Suktam.
Shri Gurubhyo Namaha Harihi Om Sahana Bhavatu Sahanau Bhunaktu Saha Viryankaravavahai Tejasvi Navadhitamastu Ma Vidvishavahai Om Shanti 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 Na karmana na prajaya dhane na tyage naike amritatvamaanashuhu Parena na kannihitam guhayam vibhrajate tadyatayo vishanti Vedanta Vijnana Sunischitartha Sannyasa Yogat Yataya Shuddha Sattva Aha Te Brahma Loke Tu Para Anta Kale Paramritat Parimuchyanti Sarve Dahram Vipapam Parameshma Bhutayat Pundarikam Puramadhya Saggastham Tatrapi Dahrang Gaganam Vishokastasmin Yadantastadupasitavyam Yo Vedadau Swarah Prokto Vedante Cha Pratisthitaha Tasya Prakritilinasya Yah Parassa Maheshwaraha Om Shanti 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 Harihi Om Tat Sat Shri Sai Ishwararpanamastu
We will now have a summary of the conference presented by Dhruv Satish. Dhruv is pursuing his first year MBBS at the Sri Madhusudan Sai Institute of Medical Sciences and Research.
Om Shri Sai Ram, offering our most loving salutations at the lotus feet of our Divine Master, Sadguru Sri Madhusudan Sai, Honorable Minister for Health and Family Welfare, Sri Dinesh Gundu Rao ji, respected elders, dear brothers and sisters, a loving and hearty Sai Ram to all. Over the last 2 days, we witnessed a confluence of individuals, institutions, and public sector organizations, those contributing to healthcare system of this country and the world. There were illuminating talks, interesting deliberations, and potential interactions for collaborative partnerships and collective growth. Here is a brief summary of today's proceedings. This morning, we celebrated remarkable individuals who contributed immensely in the development of the nation and the healthcare sector. Awards were presented to 6 exemplary individuals who have achieved outstanding success in their respective fields, as well as making quality healthcare services accessible and affordable to all. One of the awardees, Ms. Megha Vaid, Director Corporate Affairs, Concord Biotech, spoke on behalf of all the dignitaries. She expressed her appreciation and applauded the magnitude of Sadhguru's service projects, and she also was very keen to announce an MOU between her institution and Annapurna Trust. Following which, we had a talk by Dr. Sri Srinivas, Chairman Sri Sathya Sai Sanjeevani Trust. In his address, Sir spoke on how the frontrunners carry a huge responsibility in ensuring affordable and accessible healthcare services whilst not compromising on quality. He further inspired us all to serve the unserved and do the undone. Following this, we had Sadhguru's Valedictory address. In his message, Sadhguru spoke on the importance of being examples for others to follow and congratulated the pharma companies on their contribution to the healthcare system of the nation. He further asked all pharma companies to form constructive partnership with like-minded organizations like ours to serve the world better. He ended his message by saying, let us all work together, let us all work harder together to ensure that the whole world is healthy, and if not healthy, at least has access to reliable healthcare. Following this, we began with the technical sessions for the day. The first session of the day was a panel discussion on the topic quality in medicine from a regulatory perspective. The panel members all agreed and discussed that the best way to ensure quality in medicine is by implementing policies that are patient-centric, and pharma companies themselves must be vigilant and ensure that the quality of the product is not compromised for any reason. The second session was centered on the topic accessibility of primary healthcare in rural areas. It commenced with the keynote address by Chairman of Health and Education Trust, Dr. C. Srinivas. In his address, Sir spoke on the importance of the primary healthcare system and how it is the healthcare system of the entire country. He also asked all the medical students to serve in these centers and not limit themselves to working in the cities. This was followed by panel discussion on the same topic. The panel members also arrived at a similar idea and conclusion that how the primary healthcare and the primary healthcare workers are the most important factors in the health of the nation, and how we must ensure that these factors are the first priority in the development of the healthcare system of the country. The final technical session of the day was on the topic making healthcare systems accessible and affordable. The panel discussion were among esteemed panelists such as Dr. Karyappa, an ex-military public health specialist, Dr. Madan Gopal, Advisor Public Health Administration, Dr. Anuj Bhatnagar, Head of Public Health Tata Steel, Dr. Rajendra Gupta, Founder Health Parliament, and Dr. Rajiv Tandon, Director RTI International Health Program. With this, we came to an end of the technical sessions for the day. Just now, right before, we had a beautiful question and answer session with Sadhguru hosted by Dr. Sunil Gavaskar, where questions on our service projects and why we do what we do were answered by Sadhguru. Sadhguru elaborated on how our healthcare system is based on the ancient Vaidya system of India and how we must all come together for universal healthcare. Thank you. Sai Ram.
This mission of love and service of Sadguru Sri Madhusudan Sai is deeply rooted in collective action. And this collective action leads to a beautiful transformative change. We will now have a short video of the mission of love and service across the three verticals of nutrition, healthcare, and education, and how the ethos and the philosophy is based on the ancient Indian scriptures and the beautiful idea of Vasudhaiva Kutumbakam. Can we please have the video?
One world, one family, an ancient ethos that ensures happy and harmonious living is the mission statement of the young humanitarian and visionary Sri Madhusudan Sai, who walks the footsteps of his master, Sri Sathya Sai Baba, the 21st century spiritual master and philanthropist. Christened as the Sri Madhusudan Sai Global Humanitarian Mission, several institutions of public service have been established in just the last 11 years, touching and transforming the lives of millions of individuals across 33 countries, with its epicenter at Sathya Sai Grama in the village of Muddenahalli near Bengaluru Airport in the South Indian state of Karnataka. Drawing its inspiration from Sri Sathya Sai Baba's message of love all, serve all, this mission aligns with the promise of the 2030 UN Agenda for Sustainable Development, leaving no one behind. Nutrition, education, and healthcare are fundamental rights of every human being and every child, and it is the collective responsibility of the society to ensure that these basic needs are made accessible and available for all, without any discrimination and absolutely free of cost, believes Sri Madhusudan Sai. Thus, it all began. Let no child go to school hungry ever is the motto of the Annapurna Morning Nutrition Program, which started in the year 2012. Today, healthy morning nutrition in the form of cooked breakfast or through the SciSure multi-nutrient supplement is served to over 3 million school-going children every day in 23 states and 5 union territories in India and 5 countries overseas. 516 million nutritious morning meals have been served as on date by this India's largest morning nutrition program. Feed the World is yet another global nutrition movement that has served about 5 million meals to needy homeless individuals in over 15 countries. In the field of education, this mission has established about 28 educational campuses in India and 3 campuses overseas to bestow values-based education completely free of cost to about 5,000 children from the rural strata of society from grade 6 right up till doctorate studies. The Sri Sathya Sai University for Human Excellence, which is the higher education wing, has established India's first free private rural medical college, Sri Madhusudan Sai Institute of Medical Sciences and Research, on the 25th of March 2023, and it was inaugurated by the Honourable Prime Minister of India, Sri Narendra Modi. With the vision, in the rural, of the rural and for the rural, the college has commenced with 50 students in September 2023, and it shall mould rural youth into capable and compassionate healthcare professionals to serve rural geographies. The university celebrated its second convocation on the 3rd of July 2023. Srimati Draupadi Murmu, the Honourable President of India, presided over the convocation and gave away gold medals to 17 students and conferred honorary doctorates to 5 eminent individuals. About 50% of these students are first-generation graduates, and about 66% hail from families that are below the poverty line. On the healthcare vertical, over 28,000 pediatric heart surgeries and cath interventions have been done since inception in 2012 through 5 single specialty heart care hospitals in India, the Sri Sathya Sai Sanjeevani Centres for Child Heart Care at Chhattisgarh, Haryana, Maharashtra, Telangana and Karnataka, and 2 such hospitals in Fiji and Sri Lanka. It is the world's largest chain of pediatric cardiac hospitals without billing counters. Conducting research academic and training programs in pediatric cardiology, nursing, and allied healthcare services are other functions of these hospitals. 5 specialized Sri Sathya Sai Sanjeevani Mother and Child Hospitals, Sai Swasthya Primary Care Wellness Centers, Sri Sathya Sai Arogya Vahini Mobile Hospital Services for rural India are also serving the sick and needy. The Sri Sathya Sai Sarla Memorial Hospital is a completely free of cost multi-specialty hospital which is also the teaching hospital for India's first free medical college at Karnataka in South India. 12 centers for human development have also been set up across 11 countries for conducting several service and spiritual activities. In the last 11 years, 200 million USD have been invested globally for these benevolent acts of goodness through which several lives are being illumined every single day. Sri Madhusudan Sai says, "In a society, it is always about the survival of the weakest and not survival of the fittest. We must develop this sensitivity towards the needs of the less privileged and must hold ourselves responsible for each other. Only then can we create an equitable society for the future generation. The onus is on each of us, for the inevitable truth is that every individual's prosperity depends on society's collective prosperity. After all, we are all one connected whole."
The gift of free healthcare is a testament to our shared humanity. It is an acknowledgement that the right to health is not a luxury, but a cornerstone of human dignity. The provision of free healthcare is a transformative gift that empowers individuals to lead healthier and more fulfilling lives. In providing free healthcare, we invest not only in the present, but also the future. Healthy individuals are indeed the architects of vibrant societies, and they pursue education, they pursue careers, and contribute meaningfully to the progress of our world. This evening, 2 children who underwent surgeries at the Sri Madhusudan Sai Institute of Medical Sciences will be bestowed with the gift of life, or Chiranjeevi Bhava, as was beautifully christened by Sadguru. First is the baby of Malashri, who was born in this very hospital exactly a month ago on 9th November. The preterm birth meant low birth weight, poor breathing quality, and other complications of infection that developed. This little boy required sepsis, NICU management in addition to preterm birth management care. The mother, Mrs. Malashri, is a housewife, and father, who couldn't be here with us today, is a government servant. And these same facilities elsewhere would have costed the family enormous amounts which they couldn't have even thought about. After 26 days in the NICU, this little baby boy was discharged. Next is a 6-year-old Krisha Sirvi from Bagepalli, Chikbalapur. Her father, Mr. Chandra Prakash, is a small business owner, and mother, Mrs. Lakshmi, is a housewife. She couldn't be with us this evening. Malnutrition and poor health during the mother's pregnancy resulted in a congenital defect in her daughter. Throughout her infancy, Krisha often fell sick and took long periods to recover, even from a simple fever. During our hospital screening outreach program last year, she was found to have irregular heartbeat, and therefore she was operated upon. She has completely recovered and is a happy and a very healthy child today. May we now invite our Honorable Minister, Shri Dinesh Gundu to address all of us. He's a 5-time MLA in the Karnataka Assembly and has previously served as a Minister of State for Food, Civil Supplies and Consumer Affairs, Karnataka.
With the blessings of Sadguru Sri Madhusudan Sai and Honorable legendary Sri Sunil Gavaskarji, Narasimurthy avare, and Dr. Srinivas, and all the dignitaries who have come over here, and all the guests who have come over here to participate in this global healthcare conference, and dear brothers and sisters. When I walked into this place today, this was my first visit over here, and I was always looking forward to get invited to come over here, or I was just thinking that if I don't get invited, I should just come over here, because we've heard so much about this place, and this is something that I really wanted to see. And it is my good fortune that I finally got the invite. Thank you, Sadhguruji, for calling me. And to look at what has been done over here, and what is being done, and what they're planning to do in the future also. It is simply astounding, the achievement that they have been able to achieve in such a short span to set up this wonderful facility. To set up a private medical college is not an easy task, and even people with lots of money, lots of resources, they really need to think hard and plan it out to see how they can achieve and how they can make it viable. And even as a government, when we think of wanting to start medical colleges all across, we have got quite a few medical colleges, government medical colleges in Karnataka. But the thought of setting up a private medical college, even for a government, is an enormous task, because the resources that is required and the planning that is required and the amount of people who are needed to set up a good medical college is something that is it's an enormous task. And I've seen government medical colleges being built, and they take years and years and years. What Sadhguruji has been able to achieve in such a short span, in a matter of few years, to have set up this private medical colleges, I think it's nothing but divinity which could have made this happen. It's not a human achievement. And I was just going through the campus and also going through the hospital and all the other facilities that they have. And I was looking at it, and I was just asking the people who were with me that, how do you manage to run this without charging anyone? I mean, how is it even possible? And of course, it is the blessings of Sri Sathya Sai and the vision and the spiritual strength of Sadhguru and the support of so many people. But people are there to support. But at the same time, we need people who can bring people together, to make people do things which is good for others, for the good of society. And that spiritual strength is what has made all these things happen. And it is indeed a miracle that we are all over here in this wonderful setting, and we are taking part in this program. And to really see the kind of work that is possible by a human being if they really mind, or if they really think of trying to achieve something. So what is something impossible has been made possible over here. And that is, I think, gives us so much hope for humanity. Because today we are living in a world where we see so much of difficulties, so much of suffering, so many problems. And so many times it can get depressing. But when we come to a place like this, and when we meet the people over here and experience the atmosphere and the environment over here, I think it just invigorates us, gives us greater strength to take on the battles that we have ahead, and to be able to, do things, and a greater hope in the future for humanity and for future for humans. So I think I am blessed to be over here, and also being a Minister of Health in our government. Our work is to see that we try and reach as many people as possible, to give free healthcare, to give the best healthcare possible, affordable healthcare, and to the people who need it the most. And of course, we all know how government facilities work. and how the government system works. There is always problems that we face in terms of keeping up the standards, in being able to deliver the services with the right, to be able to deliver service which is really required for the patient, to be able to deliver it which will really help the patient who's coming over there. So we do face a lot of issues, and we are trying to work at it. And I think the model that we look at is a government. For us, we are spending the resources of the people to set up these kind of institutions. And today, what I've seen over here is something that I don't think any government can achieve this. This is something that is not possible for us to do. But it really inspires us to try and achieve these kind of standards in a government hospital, and these kind of standards in our public health facilities. And I was going through the data and the statistics, the number of free surgeries they've done, the number of free deliveries that they've done, the number of inpatients and outpatients they're addressing on a daily basis. And when you go to the billing counter, there's no billing counter, just a table, and there's just people just taking down the name of the patient. So definitely, it's something that really inspires me also. And I would like to request Sadhguruji that whatever support, of course, from the government that we can do for you, definitely, I think this is something that is bigger than or better than a district government hospital or a government hospital that we have. So there's something that we can tie up with you, and we can work with you on these things, and also to see how we can take, better, how we can take healthcare more to the people in the rural areas, and have some sort of an understanding where we and you can work together to, reach more people and to, have better, to be able to achieve better. And that is something that I'm really looking forward to. I've requested Guruji that, after some time we can sit together, we can sit with his people and work out something that government and the Sai Institute, Sathya Sai Institute, we can work together and, make greater things happen, make things happen which will help the people more. So it's been wonderful for me to have come over here, and I think after this visit, I'm bound to be coming here more and more often, and let's make better things happen. Thank you all. Thank you, Sadhguruji.
Thank you, sir. Thank you for those wonderful words and your presence today. We'd like to extend a token of our love and gratitude to you. On behalf of everyone, we now pray to Sadhguru to please bless us all with the valedictory message.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखम् आप्नुयात्. May all be happy, may all be healthy, may all see good and auspicious things everywhere, may no one have any sorrow. With this ancient Indian prayer, I would like to welcome and also convey our gratitude to the Honorable Minister Dinesh Gundurao ji for coming here. I know the session is going on in Belgavi, and you had to come one day for our sake all the way just to attend this function, and you made time for us. We as an institution are very happy and grateful about. We have Dr. Sunil Gavaskar, as he needs no introduction, but one introduction which is different from his all other introductions I must give is that now he bats for us, and he's all the time traveling around the world talking about the good work that we are doing and inspiring many, many more people. Most of his fans around the world were so far only cricket lovers. Now they have become philanthropy lovers, walking in his footsteps. And he's inspired so many of them across the world. That is his great contribution. Dr. Srinivas, who is the head of Sanjeevani Hospitals, which is saving hundreds of lives every month. Every day there are tens of surgeries going on, all free of cost. And this is how we are building the country, one child at a time. By saving the future citizen of this country, of this world, we contribute to this country and the world. We have also Narasimhamurthy ji, the Chancellor of the university, somebody who founded this place 50 years ago as a young boy. And today this has grown as a place of global importance, which is now serving across 33 plus countries in these verticals of nutrition, education and health. This is how great things begin. A journey of 1,000 miles begins with a single step, said Martin Luther King. We must take that single step in good faith, with confidence, with conviction and courage. And that's what makes all the difference. So when this one step was taken to provide free of cost health care, education, nutrition to the most underserved or unserved geographies of this country and the world at large, it was that one step of faith that we took together. When the minister, Honorable Minister was asking me, how is that all this is running? And I must tell him that this is no one man's show. This is a collective contribution of thousands of nameless, faceless people from around the world who do not even want to be acknowledged. They do it selflessly because they believe in this great idea that of Vasudhaiva Kutumbakam. The people who contribute from America, so also Australia, from the eastern side of Japan or Singapore, to Europe and Middle East, they contribute from every part of the world here. And only with this idea that we are one global family, Vasudhaiva Kutumbakam, one world, one family. And when you are a family, how do you charge each other for the help that you give or help that you render to each other? A mother does not charge her baby in the morning for the breakfast that she makes and serves. There are no service charges, no GST, no service tax, nothing. It's pure love. The transaction of love that happens between the mother and the child, because it is her very own. So also a father who educates his child, a son, he does not keep account of the expenses incurred to be recovered later with interest like a bank. He does it out of a sense of love and duty towards his child. So also a brother or a sister or a grandfather or grandmother, we all do things for each other when we are a family without any commercial considerations. And that is the India that we belong to. Our ancients, our elders, they never charged each other for services as fundamental as education, health, nutrition. Our temples were annakshetras. Anybody who was hungry could go and get a meal, no questions asked. Why even temple? Even if you are a traveler, there were no lodges and hotels and restaurants. So people would just walk in good faith from their homes for pilgrimages. And wherever they stop, any part of the country, knock on any door, they would be served a meal and given water and even a little place to rest for the night before they continue their journey next day. No questions asked, no verifications done. We all believed we were a family. Our Gurukulams, which were patronized by the kings, by the well-off people in the society, they ran for free. And the princes, like the Rama and Sri Krishna and those, and also those poor like Kuchelas, they all studied in the same Gurukulam. And they all could study together because there was no fee barrier. The rich could study, the poor could study. They could get the same quality of education. That is the India that we belong to. And when it comes to healthcare, the Vaidyalayas were free. They were patronized by the kings, by the temples. And every temple had a Vaidya who would render service to the people of that community. And Vaidya's welfare was looked after by the people of the community, by the temple or by the kings. There was no question of him asking for a charge or a fee for the services that he or she rendered. That is the kind of India that we belong to. Unfortunately, with the onslaught of all the commercialization of every of these services, the scenario has changed. But we as an institution believe in these ancient Indian ideals of making health, education and nutrition as fundamental right of every person. If they can afford it by their means, well and good. But if for some reason they cannot, then it is the collective duty and responsibility of the entire society to provide for them. I had to pen a note for the Annapurna annual report. And I'm running out of ideas. You see so many reports, so many times we produce, and I don't know what to write again in an opening remark. I was thinking, and this thought occurred to me, how are you going to talk to the child about the greatness of this country, India, which is tens of, whatever, thousands of years old, which had Rama, Krishna, and the likes of these great masters walk on this earth, who is hungry in the morning and nobody is serving him a meal? How do you talk to him about scientists and innovations and inventions and the global trends, who still hasn't had his first meal of the day? What gratitude would a child like this carry in his heart for the country or the people of the country? What pride can he have? What patriotism can we expect from a child who goes hungry every day when the rest of the society eats to its fill? So to create a country where every child gets his right to nutrition, whether his parents can afford or not, or education, whether his parents could afford or not, or healthcare facility, it's the duty of every one of us. And we should do it in the spirit of a family. We are one world, one family. Need of the hour is this feeling of oneness. While all other mechanisms are in place, there are government organizations, public sector ventures, there are private sector institutions, charitable institutions. We all are working together hand in hand in productive partnerships to deliver the last mile service to the needy. Yet the greater unifying force for all of us to make it happen is the idea that we are all one global human family. And it is our bounden duty to look after each other's welfare. And when we do that, the world will become a better place to live in. So the legacy of Bhagavan Sri Sathya Sai Baba is a better world where everybody lives for each other and all live for God. They all work for each other and collectively they work for God. They do God's work in the world. That is the kind of world that we are looking at creating. And all these institutions, all these baby steps are towards that great vision of one unified world where nobody goes hungry, nobody is uneducated, nobody is unhealthy. Everybody has a roof above their heads, clothes on their body, and all the things that are required for leading a simple, normal, comfortable life. That is the kind of equitable world that we are working towards. I can only express gratitude to the organizers of this conference who brought together many great leaders from around the world to think and to act towards this goal. The pharmaceutical companies, the healthcare institutions, the government institutions, the regulators who came, and also the charitable institutions and NGOs who participated. To all of them, I want to convey that this is the way to go. We must forge partnerships so that we can help each other serve the people better. At the end, the goal is only one, as the minister very clearly said. The goal is to serve the poorest person in the country. Make sure that healthcare is accessible to the last and the least person in the country. Governments are trying their best. Private sector is doing their job. NGOs are doing their job. But if we all work together and find gaps and identify those gaps and fill it with our collective effort, I think we can achieve this vision of Sarve Bhavantu Sukhinah, Sarve Santu Niramayaha in a short span of time. That's my conviction. To the organizers, I also want to convey that while we have done a lot of thinking and churned out a lot of great ideas, I would be very happy to see these ideas put into action. Because knowledge without action is useless. All the knowledge that we gather and we don't put into action gets lost in the passage of time. So putting all the knowledge that we have gained out of this convention into action is the need. And I hope that we can sit together, as even the minister said, after a few days, maybe when we have consolidated all these ideas and put them in a framework and a structure, sit together and make partnerships that can help these ideas to be put into action, meaningful action, which will help the last person in the country. I'm in particular very appreciative. I was reading in the newspapers, the minister himself is very committed to providing universal healthcare access to the people in Karnataka by issuing a lot more health cards in the coming days. That is the commitment that they have made, and I'm looking forward to a partnership there, because our hospitals can be partners of the government in providing healthcare. The country is very large, and somebody said when I was in the US, what is the government of India doing? I said, if you had the population as large as India, you tell me what your government would be doing. You have one-fourth of the population of India, and maybe, I don't know, 5 times the GDP, and still you have not been able to make the healthcare accessible to the last person in your country. The government of US and government in India are doing their best to provide healthcare to as many people as possible. Of course, we are a large country. We just set out on a mission. It will take a while. will take a while. But the good news is that we are on the journey. We have started this process. We have got the ball rolling. And that is the good news. So in Karnataka, which is our homeland, which is our, what you call the bastion, the origin of all these good things, I want to see to that every village, every town, every district has centers of excellence, not just centers of healthcare, but they are centers of excellence where healthcare is of highest quality is provided at no cost to the patients. Cost could be to the society, to the government, to the NGOs, but no cost to the beneficiary at the end. And one step that we took towards achieving this is by starting a free medical college, which also has nursing and paramedical sciences courses. All this is provided free so that when there is no cost to their education, there is no loan or no debt that they have taken to get an education, they will not worry about recovering that money after they get educated. They will be more open to serving the society, sacrificing for the greater good of the society. With this idea, this institution had started. We needed all the help in the world to begin this medical school, and I'm very happy that we received that kind of help from the governments, from private sector, through their CSR, from many philanthropists and everybody else who have come together. For this medical college, particularly this year, we wanted a certain special provision. Our idea was to ensure that the rural and the most needy children get into this medical college because it is free. Those who can afford to pay or get an education by other means, they should look at other institutions. This is what my idea was, and I was very much after the government to give us some special provision. In the last session, it could not be done completely because there was hardly any time left before the college began. But still, they gave us the provision that as an institution where we're giving free seats, all these children would be able to commit themselves to a service tenure of as many years as they study in our institutions. This was a special provision that the government of Karnataka and of course, which the cabinet, which Gundu Rauji is a part of, provided us with is a special provision, and we are thankful for that. What did it do? It attracted the right kind of students to our institutions. And there are students, there are a lot of girls, I think 18 of them are girls, the rest of them are boys, but majority of them come from families. I was told 55% of them come from families who have less than $300 as their monthly income. That is less than 15,000 or let's say 20,000 rupees a month. And that is for the family of 5-6 people. That kind of families have got benefited because of this rule that you put in place that ensured that people who are service-minded, they're committed to the betterment of society, alone apply to these colleges. And we have received those kind of students. They're very committed, very dedicated. Many of them have told me already, Swamiji, what is this 5-year tenure? We are here with you for lifetime. We will work with you in this mission forever. And very interestingly, when I asked somebody that why are you putting your daughter over here? And they said, because this is the safest medical college that I can find in the country. It is because the environment is so good and children will be protected and they will also grow well. The kind of clinical material that they get here, it will give them very good training. And I also want to bring to your attention that we have got very good faculty. We never thought we will be able to kind of fulfill the criteria for all the faculty recruitment in a short time, because when you have Bangalore next door, who wants to come and work in a village? But to our surprise, so many dedicated people who are inspired by this ideal that healthcare should be delivered free and health education should be free, they came and joined us. And we could fulfill all the requirement of NMC to start the medical school. And all this is definitely the divine grace, that is for sure. But more than that, divine grace is nothing if it doesn't find the right kind of instruments to execute it. So all our faculty, our staff, all our trustees, volunteers, they are all those instruments of God who have made this medical miracle happen in this very holy land where Sir M. Vishweshwaraya was born. And yesterday I was mentioning, this is the potential of a rural child who can be born across the road here in Muddenahalli and go on to become Bharat Ratna. That is the potential of a rural child if we give them the right kind of opportunities. So I look forward to making many more Ratnas, if not Bharat Ratna, Karnataka Ratnas out of our students and staff over here who have committed to a life of service. We have representation from DNB, Dr. Bajpai, the executive director, and he also was very moved by the efforts. And he has promised us to fast track the PG courses, the DNB postgraduate courses, so that specialists can be created for rural areas. That is what is lacking. And we will work with the district hospitals, as you mentioned, to ensure that the children are getting enough exposure, enough clinical load and material. We have MOUs with the right kind of partners, and we can create some fast-track courses where the super specialization or sub-specialization can happen in a shorter tenure. That is the world that we are trying to build, one child at a time. And all of us are stakeholders, all of us are partners in progress. Nobody is greater, nobody is lesser. We are all equally responsible for the betterment of our society, our world. And I am very grateful that this convention is concluded very well. I've met a lot of people over the last 2 days, very new people, first time comers over here. They all went back with a sense of fulfillment and a commitment to further the cause of free healthcare in our country. I also want to especially thank Dharmadatta Garu, who was the earlier, he's right now sitting here, the former drug controller, and he made a lot of efforts to bring everybody together from around the country and dedicated his services to this institution. So I'm very grateful to him for his effort and all the volunteers who have taken part. Last but not the least, to the students, the future generation, I just mentioned, our Vaidyas were Sarva Guna Sampanna. They were their own pharmacists, they were their own pharmaceutical companies, they were their own pathologists, they were their own diagnostics. They knew everything. They never thought those specialties are for some other people and I am here only to diagnose the patient and treat. No, they were doing everything. You should also develop that kind of capability and skill set, where you understand the entire spectrum of healthcare delivery and not just your medical knowledge. You should be able to work with all stakeholders in the society to further the cause of good healthcare. And that is the future that I'm looking at. The first lecture I told you, don't just look at yourself as becoming physicians or doctors as individuals. Become institution builders. Make sure that each one of you starts an institution with all the knowledge and experience that you get here. And that's how we can make the healthcare accessible to all the people in the country. And to begin with, we want to really expand and serve in rural geographies of Karnataka by opening a lot of diagnostic and wellness centers, which will be connected through hub and spoke model with our college over here, so that any patient from any part of the Karnataka needing immediate medical attention and cannot afford it can be easily transported to this hospital, given entire care and sent back to whichever place they come from. So the entire spectrum of care is totally free, no out-of-pocket expenses. And that is a partnership that I'm again looking at working with the government of Karnataka. Once again, thanking everybody and praying that may good happen to all. Samasta loka sukhino bhavantu. May everybody be happy. Thanking the minister once again for his gracious presence and look forward to many more visits in the future.
Our gratitude to Sadhguru for those illuminating words. May we now please invite on stage for the vote of thanks Dr. Dharmadatta Ji, former Drug Control Director, Andhra Pradesh and Advisor, Shri Madhusudan Sai Institute of Medical Sciences and Research.
Om Sri Sai Ram. My humble pranams to the lotus feet of Sadhguru Sri Madhusudan Sai. At the outset, on behalf of the Satya Sai Sujala Sravanti Trust and also the various trusts like Sanjeevani Trust and Balasundari Trust, on behalf of all the trusts, I express my deep sense of gratitude and expressing thanks to all who have come over here and with their august presence made it a great success, great event today. Because without you, it would not have been possible in such a great manner. Simply for the purpose of vote of thanks, if I say thanks, I think I will not feel happy. It is not satisfying me. I will say few words because how your presence is made a great thing here. So now, previously, now and then, our Sadhguru was referring the pharmaceuticals are very, very important for our mission to go forward. So, he is a great divine spiritual leader. He could understand how deeply it is involved, connected with this healthcare system. If you just compare the healthcare system, just like a wheel, it is the various facets of the system, like medical doctors, nursing system, or any paramedical system, dental system, all the various facets of the wheel, the fulcrum is the pharmaceuticals, medicines. This will not run without the pharmaceuticals. Just like if you compare a system as a vehicle, the fuel is the pharmaceuticals, medicines are the fuels. Otherwise, the other facets of these systems will not run. This is a very important. So now and then it was referring. That is why on taking his advice and guidance, we have tried a lot to bring all the pharmaceutical people. I got one idea. Sunil Gavaskar was telling that this cricket is compared with the healthcare system. But here I compare actually with this idea that these medicines or drugs are compared to the spiritual system. There is a strong analogy bond between the medicines and the spirituality. Why, you know? Though medicines are prepared by various means with struggles, purifications, etc., with extractions, etc., whatever may the struggle you do, purification, you can't bring it to 100%, very difficult. Up to 95%, a lot of work could be done. After that, again, double of that or 10 times of that, if you bring it to the 100. That is why Indian standards or international standards of pharmacopoeias left the standards up from 95 to 105. No drug is pure. So drugs are associated with so many side effects. By weighing the benefits and the toxic effects, the ratio, the benefits when outweigh the side effect, then only they are releasing. No drug is purely effective without side effects. All are poisons. Simply we can say all drugs are poisons. But we have to improve, they purify it and release. Like that, the spiritual system, all human beings, at this stage, they will have animal qualities and the human qualities. The spiritual system, the Sadguru's guidance, we are removing the animal qualities and bringing to the one certain stage with the human qualities. It's just like a purification. So this also, up to this certain level, we can bring it, but 100% is very, very difficult. It will become more and more difficult when you go to the center of that. So only once you become 100% is a Bhagavan, just like our Sadguru is a Bhagavan to me, because he is 100% true. So that is why they recognizing the importance of pharmaceuticals in the healthcare system to go over. Our healthcare system, what we are following and serving is not a simple service, it is a revolutionized service, reaching the unreachables and serving the poorest people. So only the Bhagavan can do, nobody can do it. So it is such a mission, we are all part of it. And just like I have to thank each and everybody with the name at this stage, because your presence had made a lot of impact on this space conference. But your involvement, just like you see, I remember when our Minu Vajpayee's participants, yesterday it was inaugural, today is the valedictory. And yesterday's lecture, today's lecture, he did it not for the sake of just delivering, or involved all sorts of love. His words are flowing with love. His gestures are full of love. So like that, so everybody involved, even participants, just like him, all the speakers and the panelists and moderators and even the listeners, they have shown a very great qualities, and that is why this conference has become very, very successful. And whenever, if you take the pharmaceutical industry, just as I'm concerned with, whenever I telephone to a MD or a chairman of a good pharmaceutical industry or small, they're always involved in these various audits, inspections, and also in travel, in the abroad travel, because they are very, very busy people. So, of course, it is every business or every activity is like that, but pharma people, pharma business, very, very competitive business, very cutthroat business, very compared to other. That even then, some people, most of the very good number of people have come, attended with valuable time they have spent over here. Likewise, in the medical profession, hospital people, They have come, equally they are also having so many hurdles they are facing, but they have attended, and very with love and affection they have attended and done, made it a great success. Likewise, we have the nursing system people and also the software people who are connected with this healthcare system. They also came, insurance people. I thank all of them. Like that, All India Institute of Medical Sciences, it is connected, it is in combined with our activities, they have helped us a lot. I thank all the people, not simply thank, that with a folded hands and bowing my head, thank because of you, this is being great success. Thank you one and all. Thank you.
Thank you all. With this, we come to the conclusion of the Global Healthcare Conference 2023, and we thank everyone for your kind participation. Thank you very much.